Around the world, health systems are under pressure, not just from disease, but from the severe impacts of climate change. Extreme heat, flash floods, and cyclones are no longer anomalies. They are the new normal. Healthcare facilities must now do more than just treat illness. They must endure, adapt, and lead. Here in Delhi NCR, India, a new kind of hospital is taking shape. More than just a building, it is a climate-resilient, sustainable healthcare ecosystem. It answers one bold question: what if a hospital could prepare for climate risks, cut emissions, and protect community health all at once? Designed to work with nature, Amrita Hospital employs green architectural principles that honor the sun, shade, and changing seasons. Seasonal sun path analysis was used to map how sunlight interacts with the building, how it falls, reflects, and heats surfaces throughout the year. These insights shape the orientation, wall angles, and shading systems, ensuring that the interiors remain well lit with natural light while minimizing heat gain. At the heart of this vision is solar passive architecture, a design approach that utilizes building orientation, materials, and design features to naturally heat and cool a building. Even with reduced heat gain, the demand for cooling is still significant. That's where smart chillers come in, adjusting in real time to optimize energy use while maintaining comfort inside. Lighting too follows a sustainable rhythm. Daylight harvesting reduces the need for artificial lights, proving that sustainability isn't an afterthought but part of the design from the very beginning. Every corridor, atrium, and ward here is designed to foster a connection with the natural environment. Sustainability here is not just about energy, it includes the land itself and how to cool a campus of this scale without worsening the urban heat island effect. The master plan disperses buildings across the landscape to allow natural air currents to flow between them. Open spaces are not just ornamental, they are carefully designed microclimates featuring bioswales that are shallow planted channels that capture and slow down rainwater, reducing flood risk while filtering pollutants and charging groundwater. Together, these elements support natural cooling through evapotranspiration. Recycled water from the hospital is used in cooling towers, flushing systems, and then flows through landscaped water channels. The final runoff enters an artificial lake where it percolates into the ground or evaporates naturally. Climate is no longer predictable. Floods that were once rare are now increasingly common. That's why Amrita's critical infrastructure, including oxygen supply lines and electrical systems, is built above the highest historically recorded flood levels. Radiation bunkers, typically housed underground, have been elevated and designed with massive concrete protection on stilts to ensure safety even in the worst-case scenarios. This region is prone to high-velocity winds and is in the earthquake risk zone Seismic Zone 4. So every structure here is designed to withstand winds of up to 235 km per hour and the strongest seismic shocks while ensuring safety and uninterrupted operations. At full capacity, over 7,000 people will live, work, and heal on this campus. From heat-reflecting stones to shade-providing trees, every detail supports both resilience and well-being. This is more than architecture. It's a working model of how health systems can align with nature and climate realities. Climate-resilient, sustainable healthcare isn't optional. It is the future.